So we'll start with the first lecture, which is the basic physical principles of ultrasound, including safety of ultrasound. In this lecture, the learning objectives will be, after the lecture, you'll be able to explain how an ultrasound image is generated, describe the different ultrasound modes used for imaging, describe the current international safety standards relating to the thermal index and the mechanical index. The key questions are: what is ultrasound? How is a B-mode ultrasound real-time image produced? And how should the ALARA principle be applied? So let's start beginning with the sound. Sound is a longitudinal mechanical wave. You should imagine a particle which is moving from this point, goes up, comes down and goes up again. And it is transmitted through the medium by local displacement of particles within the medium. So if you take air, if you take any sort of solid tissue, you consider them as made up of a lot of particles, and one particle vibrates. It vibrates successive particles in motion by a series of compressions and rarefactions. And we describe the sound in terms of frequency. Frequency is nothing but number of cycles per second. If you take one particle going up and a crest and as a trough and completes one cycle, this is called as one cycle of sound, and this the number of cycles in 1 second is called as frequency. Now, why do we need to know about frequency? The human audible range is from 20 cycles per second or 20 hertz to 20,000 cycles per second or 20 kilohertz. So ultrasound are frequencies above the audible range. There are a few other things which we need to know about the sound wave itself. One is called the amplitude. I'll talk about that presently. The length of the one wave is called as wavelength, and it is given by the term lambda. And the time taken for one wave to be completed is called the period. Now let's come back to sound. As I said earlier, sound is a compressional wave, and it can go through gas, liquid or solid medium, and the speed of sound, it depends on the medium and the temperature. Right? Sound travels through air at 343 meters per second, through water at 1482 meters per second, through steel at 5960 meters per second, and the average speed of sound in biological tissue is 1540 meters per second. And this 1540 number is very critical to remember, because this is what the ultrasound machine uses for calculating distances. It calculates the average speed of sound and gives you the distance traveled by sound. Now, we said about 20,000 cycles per second is called ultrasound. Medical ultrasound uses 1 to 20 megahertz. 1 megahertz is 1 million cycles per second. So 1 to 20 megahertz. The most common frequencies, of course, being 3.5 megahertz, which is there. So if you, when you produce a sound, you can see this is a low frequency sound and this is a high frequency sound. When you see the high frequency sound, obviously you can see the number of waves. The low frequency sound, the number of waves are lesser, and high frequency sound, the number of waves are more. Right. Now, the other thing about the sound wave itself is when the sound becomes louder, the amplitude of the wave becomes taller and taller. So the higher the intensity of the sound, the higher the amplitude of the wave. And the amplitude also gives us the power that comes out of the sound. So when in your ultrasound machine you want to adjust the power output, the amplitude of the wave is what is altered. So the higher the amplitude, the louder the signal, the higher the power. Now we need to take ultrasound, which we know is about 20,000 cycles per second, and we are talking in the range of megahertz. From the ultrasound we need to convert it to an image. Now how is it done? Is by using the piezoelectric effect. Now the piezoelectric effect has the ability to generate an electrical charge in response to an applied mechanical stress and vice versa. Now what in simple language this actually means that if you have a piezoelectric crystal and you go and mechanically vibrate it, it will produce some electricity, small voltage of electricity. And when the sound comes back and hits the crystal, the crystal will vibrate, and it is called as a reverse piezoelectric effect. So the piezoelectric crystals that are used are quartz, zirconium titanate, and they're all modern ceramic. These are all synthetic crystals which are made. So what happens is when the crystal vibrates, there is an air column in front which gets compressed, or the particles in the medium gets compressed, and once the sound goes away, there's a rarefaction. So there's a compression and rarefaction, which happens, which causes the sound waves to be produced. So here is the vibration of a crystal which is causing the voltage, and in this what happens is the echoes which come back to the transducer creates these voltages, and these voltages are displayed on a monitor as waves. So this is called as the A mode, or the amplitude modulation. So whatever echoes are coming back are converted into signals which are translated onto the screen. Now the modern day ultrasound is, we don't use A mode for routine imaging, we use what is called as B mode or brightness modulation. So here the ultrasound transducer has become a little bit more sophisticated, where you can see a number of crystals. The piezoelectric crystals are arranged in an array fashion. There is also a grounding electrode, and there's something known as a matching layer, and there is a lens. All this is made, that the transducer is made up of all this. As you can see here, this phase consists of all these elements put together. The matching layer actually helps you to prevent reflections happening there, and the lens helps you to focus the ultrasound beam to a specific area. Now, how does this now get translated from ultrasound to image? So once you have the transducer, the ultrasound machine starts throwing, vibrating these crystals in short pulses. And once the vibration takes place, the vibrations go through the human tissue, and as they go and encounter an object where there is a reflection, and this reflection comes back, depending on the depth of the reflection, the echoes are produced on the screen as dots. So how far the sound travels? For example, the sound traveling here is reflected from a closer distance, whereas this sound went farther distance. So the distance of the reflector is calculated by using a simple formula called distance is equal to velocity into time. So you take half the time it takes to go and come back, and that tells you the distance from which the echo was, the sound was reflected. And then these dots together formed an image which we call as the B mode or brightness modulated image. Now, if you imagine the crystal, the transducer, as having a number of crystals side by side, and if you imagine each of those crystals is producing an ultrasound beam, and what happens is you successively form these sound waves as you go through the entire, all the crystals in the transducer, and the process starts all over again. So once the entire process is completed, from the first line to the last line, a number of lines are created, it forms one image. And then image, if these lines are successively done repeatedly, you are able to form one image, or this is called as one frame. Now once you have a number of frames which take place, then you have an impression of real time. It's also important to remember that when you use a sector, there are number of lines. The more the number of lines which you use to produce the image, the longer the time it takes, and when the sectors are very large in number, the lines are very close to each other, it will produce a very good image, but it will take a long time to produce the image, and the overall frame rate will come down. That's why you see when people do echocardiography, once you tell the machine that you're going to do echocardiography, it automatically brings to a smaller sector so that the heart is going at a very fast rate and the frame rate can be kept up with the heart rate. Now, when you're looking at deeper structures, it is certainly going to take a long time, because every time the pulse goes, hits at the object and comes back again, there's a time involved. So the deeper it has to travel, the longer the pulse takes to go and come back, so the frame rate actually goes down. Now the other thing is that here is an organ which is continuously moving, like the heart. So when it is continuously moving, when the ultrasound waves come, the heart is constantly moving, and the reflections from each of those interfaces are also moving up and down. So what happens is, to capture that information, these echoes which are happening in successive portions of the heart are actually moving up and down, and when you move the screen, it actually forms a wave. So what happens is, here's a B mode where you're getting B mode reflections, but you're moving the screen because the object is constantly moving, and that produces the waveform which gives you the M mode of the transducer. Right. So you have seen A mode, we have seen M mode, and we have seen the B mode. The next thing we must know about is frequency, resolution, and penetration. Now, whenever you use a low frequency transducer, let's say you're using a 3.5 megahertz transducer, you have a lesser resolution, but there is more penetration, because with a 3.5 megahertz transducer, you can penetrate up to 10 to 20 centimeters of human tissue. When you have a high frequency transducer, you have a much higher resolution, but there is less penetration. For example, if I use a 10 megahertz transducer, the penetration will be only 1 to 4 centimeters. The reason here, we are telling this here, is if you want to deliberately look at objects which are very close to the transducer, you always prefer to use a higher frequency transducer. For example, if I want to image the thyroid gland, I will not use a 3.5 megahertz transducer, because the thyroid gland is very close to each other, very close to the transducer. So I will use a 5 to 10 megahertz transducer, which gives me much better resolution. Similarly, women who are the BMI is higher, you will have to use a lower frequency transducer, whereas women with a lower BMI, you can have a higher frequency transducer. The next issue is the resolution. Now, the image resolution is of two types. One is called the lateral resolution, and the axial resolution. We also have the temporal resolution. Now, lateral resolution is when the object is there and you see echoes coming from successive objects. The echoes which are placed side to side with each other, the closest distance between the two reflectors is called as the lateral resolution. So, for example, if there are two interfaces which are 1 millimeter apart, and both these are shown as two individual dots, so that resolution, lateral resolution, is 1 millimeter. Supposing the two echoes are 0.5 millimeters apart, and you're able to see it as two separate dots, so that lateral resolution is 0.5 millimeters. So you keep on reducing the distance till a point comes that both these will seen as only one echo. That means the lateral resolution is not there anymore. So the lateral resolution, the closer the interfaces are, the better the lateral, and both of them are shown as two individual dots, the better is the lateral resolution. In axial resolution, the interfaces which are along the path of the ultrasound beam. So as the ultrasound beam goes further and further downwards, which are the reflections which are coming one below the other, the distance between these reflectors, one below the other, gives you the axial resolution or longitudinal resolution. The temporal resolution is over a period of time between successive frames, what is the resolution that is obtained. Then there's a very important advancement that happened in the physics of ultrasound, which is called tissue harmonic imaging. Now remember, when you send a 3.5 megahertz pulse downwards, and it goes and gets reflected and comes back, the tissue vibrates, and the tissue vibrates not only at 3.5 megahertz, it is also vibrating at double the frequency, which is called as the second harmonic. It also vibrates at the third harmonic, 3 times the frequency, and 4 times the frequency. This is as per laws of physics. So this is something which is happening all the time in the tissue, that once you send a sound of one particular frequency, the tissue vibrates at the same frequency. It also vibrates at the second and third and fourth harmonic frequencies. This is similar to when you are using a stringed instrument. When you pluck the instrument, you have second, third and fourth harmonics. Now, when we tell the ultrasound machine, you send the ultrasound wave at 3.5 megahertz, but when you receive it, you listen to only the 7 megahertz, or the double the frequency. Then what happens? The image resolution totally enhances and you get a much better image. As you can see here, this is the nodule which you can see. Once you switch on the harmonics, you can see how well the nodule is brought out. So the harmonic frequencies are double the transmitted frequencies. That is what we try to listen. Right. Then we come to artifacts. Now artifact is, and whenever you do ultrasound, there are some portions of the image which are not real, which appear to be real but are not real. So artificial echoes masquerading as factual echoes. That's what we call as artifacts. And the ultrasound image does not match the anatomy. So for example, here is acoustic shadowing. So you can see the shadowing, the dark area posterior to a dense reflector. It's most marked along the ultrasound beam. If you put your beam perpendicular to a very strong reflector, then you have a shadowing behind that. So what you can do, you can readjust your angle of inclination, and if you see the artifact moving along with that, you use this acoustic shadowing to identify calcifications or very dense tissues. The other artifact, which we call as actually a good artifact, is called posterior enhancement or amplification. Imagine the ultrasound beam going through this tissue. As it goes through the tissue here, the sound gets absorbed, and the sound energy as it goes through here is lesser and lesser and lesser as it goes deeper to the tissue. Whereas here, there is a cystic lesion. As sound goes through this tissue, it doesn't get absorbed here, so the sound coming immediately at the back of the cystic lesion has got a higher amplitude. And because it has got a higher amplitude and higher energy, you are able to see it brighter. And this is called as acoustic enhancement. It's an area of increased brightness immediately posterior to the cystic structure. It is caused by lack of sound attenuation through the structure in a few interfaces. So you can move your probe to different directions, and you can see how this acoustic enhancement also changes along with the direction of the beam, and you can confirm that. The other artifact is called reverberation artifact. Now reverberation artifact occurs when ultrasound beam encounters two strong parallel reflectors. And what happens is, it's like standing in front of a mirror. If you have a mirror at your back side and also in your front side, you will be able to see your face several times in the mirror. So this is called as multiple internal reflection. And here multiple parallel echoes result from traveling back and forth of ultrasound between the two reflecting surfaces. And here also, when you change your angle of inclination, the reverberation artifacts will move. The whole idea is to ensure you identify them as artifact and don't misinterpret them as that. To give you a classical example of reverberation artifact is when you place your probe in front of the bladder, urinary bladder, so that the top wall of the bladder will do multiple internal reflections, and inside the bladder you can see these echoes which are coming back and gives you that strong reflection. So the transducer face itself is looking at is considered as a reflector. So here also you can change your angle of inclination to do that. Then you have the side lobe artifact, which results from a strong reflector that lies outside the incident beam, but within the side lobe or the central beam. That means when the ultrasound beam is produced, there is a central beam. There are also some side beams which go through, and these also the tissue appears along the side beam, and they look as if they are originating from the central beam. So here, for example, is a side lobe artifact. Very classical example. You can easily mistake this for a membrane in a twin pregnancy. So you can mistake it for a membrane, and you have a wrong diagnosis, that side lobe artifact. Lastly, we'll talk about safety issues and biological effect. When sound insonates a tissue, the tissue particles are vibrating, and this vibration causes a rise in temperature. Okay, and then they can cause some gas bubbles and can collapse. The gas bubbles can collapse, which called as cavitation effect, and this results from the pressure wave released into the surrounding tissue. So there's an increase in the pressure, there's cavitation, there is also a rise in temperature. This rise in temperature is what worries us a lot. Now this is called as thermal index, and the thermal index is the power needed to increase the temperature by 1 degree, right? And this thermal index is usually should be less than 1. The mechanical index should also be less than 1, is where it's the one which causes the cavitation effect. And then we have this principle called the ALARA principle, as low as reasonably achievable. That is, use the least power and the least exposure required for diagnostic purposes. So let's see how long can you actually scan a patient safely. So if you keep your thermal index less than 0.7, then it is the recommended range provided adequate images can be time, and there is, even though the time is unlimited, you prefer to look at the ALARA principle. You do the scan for as much time as it required, and then try to finish the scan in an effective manner. As the thermal index increases, the time of scanning before damage occurs becomes less and less. If you have a thermal index of less than 3, you can scan only for less than 1 minute, and more than 3 it is really not recommended. Now there are two things. When you see the early pregnancy fetus, it is, let's say, 10 weeks, the bones are still not yet formed, the fetus is all soft tissue, so we use the term called TIS, it is thermal index for soft tissue, and after 10 weeks we use the TIB, or thermal index of bone, right? And when you look at the power levels, as the power increases, the heating potential also increases. B mode, 2D and 3D have got the lowest power. The harmonic imaging is the next. Then you have M mode, you have color Doppler, and pulse Doppler has got the highest power output. So that is why we don't recommend using pulse Doppler on an 8-week fetus to do your heart rate measurement. You use M mode instead. So you can go through the ISWAQ safety standards, and also the British Medical Ultrasound safety standards and the AIUM safety standards. All these organizations have put up safety standards on the website. So the key points are: understand how an ultrasound beam produces an image, recognize artifacts and know how to avoid them, understand the factors important to obtain an optimal Doppler signal, and be aware of the principles of thermal index and mechanical index.